Is our 1067th day. Let's start our meeting with silent prayer. Good evening and welcome everyone for today's session. Today is our 1067th day, and today's our guest is Lubna Kamal. She's MD Homeopathy, MBA and PhD. She's the Associate Professor in the Department of Materia Medica in the State Jawaharlal Nehru Homeopathic Medical College, Lucknow. And she's a homeopathic nephrologist and treating renal failure and other patients like chronic diseases since for last 2 decades. So today's our topic is status of education in homeopathy. Dr. Lubna Kamal, I'm welcoming you to our session. Please.
Yeah, thank you so much.
And I have to share, right?
Yeah, please. So the most important thing I wanted to share today is the importance of research and publication in homeopathy, as well as its impact on the education system we have in homeopathy. Next, please. Next slide, please. This is a chart. It is a pictorial depiction of the work we have been doing since last 20 years or so. So it's over 1,000 cases, and 80% of the patients have improved. It's very small, so I won't be able to read much. But then I think it's, is it visible to everyone? No.
Yeah, visible, but not clear because small letters, right?
Yeah, okay. We have actually already discussed it. I have been on this platform for this is, I suppose this is the 6th time I'm here. So we have already discussed, but I wanted to just recapitulate. Next slide, please. So this was the research paper that we have already published, the previous slide. And this is what we got. We have been felicitated by Influencer Book of World Records, Malaysia, for treating the maximum number of renal failure patients with homeopathy. So this is something which can be achieved by anyone and everyone, all the homeopathic doctors. And in the coming slides, we'll discuss how and why is it important. Next, please. Now, this is the problem I've been dealing with, because it was one of the biggest problems we are facing today, because the mortality rate actually, on one hand, the mortality rate for most of the non-communicable disease has decreased, while in renal failure, it has increased. And there is absolutely no treatment in allopathy except for dialysis and transplant. So this is how our study becomes very important to tackle the menace of non-communicable diseases and for homeopathy as well. Next, please. So by 2040, the renal failure will actually be the 5th leading cause of death amongst all the diseases, and it is just now the 16th cause, and in a few years from now it will be the 5th leading cause of death. And this is why this is the problem, and homeopathy is the solution. All right, next, please. Now, this is another important thing, because I handle an NGO also, and I wanted to share this as well, because I have made a proposal. I have submitted the proposal today itself to the ACS of Ayush department over here in Uttar Pradesh. And homeopathic medical colleges can be a very important centers of prevention of diseases as well, because relatively, as if you compare it with an allopathic medical colleges, we have less number of patients. So after 2 p.m., after once the OPD hours are over, we can definitely, screen the patients in detail, because that is what I saw in Balrampur Hospital. There's a hospital in Lucknow, and there this kind of screening would be done, but they have very sophisticated machines and everything. But what we can do is we can just start with this, because in the time, like when the OPD gets over, we do not have many number of patients for IPD. So that is when we can screen these patients. And it is very important. This was the chart that was submitted in C20 program, which is the part of G20, and we had submitted our proposal, and it was accepted, and there was this holistic integrated health program in Faridabad. It was a 3-day program where I had submitted these charts, and I had presented them. There were people from all over world. A lot of countries were there. Next, please. And this is the comprehensive report we have prepared, related with everything related to renal failure, its prevention, its treatment, the role of homeopathy, the role of allopathy, and it has already been submitted to a lot of places, and it will be submitted to a few more. We'll just see. Next, please. Next slide, please.
Sorry.
No, it's okay. So we intend to submit this report to the president, to the PMO, to all the whatever is listed over here, so that firstly there can be a preventive blanket preventive program, so as to stop CKD from progressing. And the second thing is role of homeopathy, how homeopathy can help, and how homeopathy can be of use to prevent dialysis and for transplant. Next, please. This is another report I have submitted again to various departments, which is how to improve the teaching standards, what all needs to be done in a homeopathic medical college. Next, please. Next. Now, the most important things that I feel, because I've taught the UG students as well as the PG students. So these are the most important topics which need to be understood before passing of UG exams, because I had recently written an article on exit exams in homeopathy, and why is it more important than even allopathic medical colleges or MBBS course. Because see what happened when I took to homeopathy. So I had got admission into some private college of MBBS, but then I left it and I joined this. But the situation of the college was very bad at that time, and in order to learn homeopathy right from the very first year, I had joined a clinic, and throughout the 4 semesters, the 4 professionals, I went to that doctor, to that homeopathic doctor, to understand everything. Then there was a teacher of mine, Dr. SM Singh sir, who was teaching in Allahabad in that medical college, and I used to stand in his OPD. There was so much of rush in his OPD, and yet I would go there like right from the first year, because since we were first and second year students, we were not allowed to sit over there. But I would stand, I would to keep on taking up as much as I can. I used to go there and stand in his OPD to learn. Then after that, once I completed, So I was very well versed with the smallest of the things of homeopathy. I was able to tackle all the kind of cases, but then I felt that more needs to be learned, which is when I joined Dr. Girish Gupta sir from Lucknow to understand the research, the kind of research he was doing, the scope of whatever scope was available for a homeopathic doctor. The most important thing I learned over there was documentation. How evidence-based medicine is important and how you do it actually. So these are the few points which I've found in my students, which I found in the students of homeopathy, that it is lacking for UG. Especially the most important thing is memorizing the materia medica, how to make it easier for the first year and the second year students, because they are extremely confused. The second most important thing is the understanding the pathophysiology of materia medica. We do not have very good books over here on this topic, and it is one of the most important topics, which is where homeopathy is lacking, where we are lagging behind. So the pathophysiology needs to be understood in the greatest possible detail. The third important thing is the case taking, because right from the very first year I had been taking cases, and by the time I joined Dr. Girish Gupta sir as a assistant physician, I had taken up at least 5,000 cases. I mean, I had taken them well and I had repertorized them. So by the time I was an assistant physician, I was into job, most of the things were on my fingertips. So this is something very important, that from second year onwards, this is what I've been doing in my OPD, in my college, that I always try to give these kind of cases, the chronic ones especially, to the students and ask them to take it and then evaluate it. Obviously, the second year students, it's not very easy, but then by the time they come to, they enter the third year or the fourth year, then by that time they are very confident and they have learned the important things. And my students, since I've been teaching over here from last 5 years, so my students are the ones I taught in second year and third year. Now they are interns and they are doing really well. They are very confident doctors, and some of them have already opened up their clinics, and they are charging 200 or 300 rupees fee for patient from the patients. Right in the internship period. So that is really great, and it would be great if the rest of the colleges to follow this kind of some protocol, that at least a student has to take 1 or 2 cases in detail in each day during their clinical classes, which is in the beginning of the day, like from 8 till 12 or till 1, they have to take up the clinical classes from the third year. So it is very important that they keep a record, they take follow-up, they learn. Gradually, it is gradually that they learn, and by the time they are in internship, they do really well. The next important thing is evaluation of symptoms. No, please, the last slide, please. No problem. So another important thing is the evaluation of symptoms. This also comes with practice. This is something which can be learned only in OPDs. This is not something which can, you can just inject into your students in the classroom. Unless and until they practice it in OPD, they will not be able to actually evaluate the case. Then applied physiology and pathology to materia medica. We'll discuss it in the next slide. Next please. Now, this is about the PG studies, which is again very important, because this is the last stage of learning homeopathy. And all this, what I'm discussing is what I have seen lacking in colleges and students. So that is the only, those are the only points I'm discussing over here. Now, if a PG student is not able, PG student is someone who should be able to evaluate the patient and select the medicine on the basis of identification of their kingdom, of their group, of their family. The process in the UG has already been learned. They are well versed with it. Now is the next step. They have to be a step ahead of their UG counterparts. So over here, they should be able to select the kingdom of the patient, which kingdom the patient belongs, which subgroup it belongs to, which family the medicine should belong to. So these are the very important things, but these are lacking in the present scenario. The next important thing is that the students are extremely, I would say, confused about the miasm. Whereas if the miasmatic analysis is appropriate, if it is correct, it is very easy to come to the simillimum without, going into 2 hours of case taking and repertorization and evaluation. That is something you do at the UG level. But when you are into the PG, you should be able to prescribe on the basis of miasmatic analysis, and that should be, that a PG student should be well versed with that. Then the next point, I'm somehow not able to view my screen properly. What is the problem? Last slide, please. So the again, now approach of different materia medica and repertory. When is the Kent's materia medica useful? When is Boric useful? The PG students should be able to make it out, and when are the different repertories in practical? I mean, they know it very well in theory, they learn it for their exams, but when it comes to practicality, when is the Kent's repertory to be used, when is the Boger's repertory to be used, then they become confused, they do not know most of the time. And these kind of, the next topic, miasm and immunology, these kind of modern topics actually needs to be, very well discussed, because most of the students, they lack this kind of knowledge. Next, please. Next slide, please. Now, what is the need for specialization, or why I started working on a specific subject, and why did I chose that subject? I've already discussed, but with 20,000, after treating 20,000 cases, I am sort of a specialist, not really one, but yes, because I have, firstly, I have data. I can show my data to lot number of the lot number of allopathic nephrologists and the scientific community as well. The data keeping is probably the most important thing, and this is where homeopathic doctors are lacking, because they are giving very good results, no doubt about it. Lot of doctors are treating lot of patients with success, but that does not mean anything if you do not have data, and if you cannot present it to the scientific community. The second important thing is the management. Why specialization is important? Because so that you are able to manage a case. A single doctor cannot be specialist of gynecology, obstetrics, ENT, nephro, cardiac troubles, everything at once. You have to understand the management of each subject differently. We might be able to give simillimum to a case of fibroid and a case of renal failure, that is okay. But what are you going to, how are you going to manage the case? That is something very serious, and that is where the homeopathic doctors actually, they fail over there. The third important thing is, unless and until we specialize, we have data, we learn to manage, we are able to satisfy the scientific community, then is when our PG seats will increase, because in MBBS, there are more than 50 topics for specialization, whereas we are having just 5 or 6. And that too is not available in all the medical colleges. So here is where we will have a lot more subjects, because homeopathy has endless, I would say, endless scope in so many things. We just lack in documentation and presentation. Otherwise, there can be please. It's okay. It's okay. Now, publication of new books, that will happen only when we are experienced and absolutely confident of treating cases of different diseases, of different problems where there is allopathic has limited scope. Because we have a lot of books on materia medica, a lot of books on organon, but the real kind of books for cancer, for renal failure, for liver cirrhosis, for psychiatry, the real kind of work is yet to be done. Next, please. Now, these are a few of the topics, and I have suggested to the NCH for keeping a data bank of all the thesis work that is being done by the PG students, and there is absolutely no use of keeping on repeating the same topics again and again. If if a student is completing their thesis on allergic rhinitis in Lucknow, then another one is doing that in South India, there is no, I mean, there's no basis. It should always, because we need more and more research, we need more and more data. That is why more and more topics are needed. Even if it is on allergic rhinitis, it has to be with newer medicines. So if we keep a data bank of thesis, then it will be easier for students to, for even guides to suggest that this topic has lesser number of theses and lesser number of patients have been evaluated by in this disease. So you go ahead and do this. So there are a lot of diseases where I have found homeopathy to be extremely useful, but then the data and the case studies, the research papers are lacking. So this is just one of my suggestions. Next, please. Now, how to be a specialist if one wants to be, because this is the question I come across every single day, because I write myself as a homeopathic nephrologist. So I come across this kind of question every single day. So my suggestion would be that in the initial years, one needs very exhaustive, extremely exhaustive case taking, which may take an hour or even more than an hour. The second important thing is the evaluation of the symptoms, which is, again, the mentals, the generals, the particulars, everything is needed initially. Then at times, this is the long process, the evaluation and everything, it takes very long. But at times we need keynote prescribing as well. At times we need pathological prescribing as well. At times I have used more than one medicine apart from, but I always select a similimum and then only I go ahead with the case. And I might add some medicine apart from that in order to give relief to the patient, because the most important thing is, especially for the beginners, that the most crucial thing is that you give some kind of relief to the patient after the first visit, no matter what the patient is coming for. If they are coming for cold, cough, anything, you have to give some sort of relief. For that, sometimes one has to do the keynote prescribing. Sometimes we do not get the mentals and the generals and everything. We have to go for the pathological prescribing as well. The next important thing to be probably the most important thing to be a specialist is evidence, records, and data. You have to have, now it is very easy because of multimedia phones to take the pictures of the reports and keep it safe. But initially, when I was working with Dr. Girish Gupta in Lucknow, he used to get photocopies of each of the reports wherever there was a finding. So we had very bulky prescriptions. Sometimes the prescription would be 10 pages long because there were 7 pages of reports. It was very tedious at that time, and sir had really spent so much of money on this record keeping and this is taking care of the evidence. But now we can do it very easily with little bit of course, giving little bit of extra time. The next important thing is publishing. Even if you cure just one single case, even if it has improved, then too you need to publish it. Publish it anywhere, preferably in a peer-reviewed journal. But then, if it is not possible, then at least in any kind of journal. It's very important. And the first thing is the publishing of case records, which is of individual cases. And the next thing is the publication of research papers where the study is of more than 20, 25 or 50 patients. Next, please. So this is what I'm trying to do. Today also there was a meeting. I've just came back and I've suggested a collaborative project between KGMC, KGMU Lucknow, SDPGI, Lohia Hospital, and NHMC. Now, NHMC is the Homeopathic Medical College in Lucknow. So I have suggested this. Why? Because if this kind of study starts, we'll automatically get few patients each day of one particular disease, and after 6 months or after 1 year, we will have data of at least 100 or 200 patients. Now, for PG students, this becomes very important, who are, just dealing with those kind of cases where there is the evidence is not required, allergic rhinitis or simple eczema or things like that. But the serious kind of studies, it will come from these kind of collaborative projects. Next, please. And this is another, I have already discussed about it, that screening is very important. This is how, if we, since I've been doing it in my NGO, so what I used to do, I would take the temperature, oxygen saturation, and blood pressure and blood sugar, which costs only 12 rupees. The blood sugar test we do at in clinic. And after that, we used to examine the patient physically from head to toe. So some of them used to come up with cataract, and they did not know. Someone had splenomegaly, again they did not know. Some of the patients had caries tooth. Then some had this cracking of knee or the carpitis in the knee. They did not know. So then is when we made them aware that you are having this kind of problem, and it may lead to several other troubles later on. So you need to get these investigation, and you need to take these medicines in homeopathy. So if the patient was interested, which they usually were, because they would consider it very important that a homeopathic doctor has found a new disease in them, which would have taken, could have threatened them in later years. So it was, we got very good response, and this is what I have suggested to all the medical colleges, to the PMO, to the president. I mean, and I've talked about its integration, Ayush medical colleges, integration of Ayush medical colleges on some news channel as well. I was there for a debate. So it will automatically again increase in a patient, because if one patient you discover something new and you diagnose it, and you tell the patient, then they are highly impressed that Dr. Saab has found something which I did not know and which no other doctor paid attention to. So they bring new patients, they bring people that you come to that medical college, they give you a lot of time, they examine you, and then it really it's very good in the long run, in every possible way. Next, please. So this is a book on entrepreneurship in homeopathy, which we are in the process of writing. We are working on it. Why? Because I felt that this is probably the most important thing why people do not want to take homeopathy, because they feel that they will not be able to earn much by taking homeopathy. Why? Because people over here, the students take up Ayurvedic medicine, BAMS, they opt for BUMS. Why? So that they can prescribe allopathic and earn a lot of money, and they join some hospitals to work as AMO and all. So they feel that with allopathic knowledge, they can earn more. While in homeopathy, there is a lot of struggle. No, it is not like that. If you prepare yourself, if you brace yourself right from the very first year, which I did, and so I can definitely say that there is a lot of scope in homeopathy to earn as well. People can, and just now it is an absolutely virgin field where there is so much of work to be done. So anyone who has braced themselves and who are willing to work hard, they can earn a lot. Next, please. This is another book. We have been in the process of writing mentorship, why it is so important in homeopathy. We are building actually a platform where we, in the coming few months or weeks, we will be able to connect the younger professionals, the younger homeopaths, the students with the senior homeopathic doctors, because a lot of time I come across and I ask seniors that, sir, if you had reportized this case, maybe the effect of the medicine would have been better, maybe you had found the better medicine. But they say that no, we do not have time for proper case taking and this and that. So in order to bridge that gap, because homeopathic doctors in their younger years, in their fresher years, they have time, they do not have much patience. They can devote their time in finding the minimum, and in turn, they can help the seniors, and the seniors, on the other hand, they can help the juniors with some amount of money, as well as to be a mentor and to guide the students or the freshers better. Next, please. This is something I have been trying to do from a lot of years. I'm trying to improve the study of materia medica, firstly, for easy learning. This is what I'm trying to incorporate. It is yet to be completed, and it will take definitely many more years. And the second thing is that the understanding the mechanism of action, how is the medicine working, why we have that particular right-sided pain in chelidonium. So if both the things, the materia medica and the physiology, the pathology and the practice of medicine, if they go hand in hand, maybe not in the first year, or maybe not even in the second year, but after third year or fourth year, there has to be this kind of study only, that why is symphytum giving improvement in the cases of fractures, or why every question. I mean, why is Cratatus improving patients of heart? What is epicynum actually doing to the kidneys? So this is something which the students have to learn in order to be more confident. So this is my effort, and people over here, everyone who's here is most welcome to join any of the things I've told. If they want to join the mentorship program, if they want to join to help writing in this book, they are most welcome. They can connect with me later. I'll post my phone number over here. Next, please. Now, this is the book on chronic renal failure, which I'm in the process of writing with several co-authors, and this will be a very comprehensive book, whatever I've learned in 20 years, that how a homeopathic doctor, because there are books in allopathy, there are a lot of books, but then how is it going to help a homeopath, or how a homeopath has to take up a case of chronic renal failure? Because there are so many patients. Even if we have one homeopathic nephrologist in each city, then too we will not be able to tackle the menace of the wave kind of the epidemic of renal failure that is ongoing. And on similar lines, there can be studies on or books on cirrhosis or maybe cancers or a lot more topics. Next, please. This is, I would like to skip because I have forgotten the reports. Actually, I've forgotten to, but I'll explain in short that this was a case of fetal growth restriction, and there was severe oligohydramnios, and it was treated with homeopathy. And since I was extremely busy, I had asked my students to take up this case, and at that time, 1 year back, they were in third year. Students who took up the case, and they were able to find the simillimum in a very short time. They suggested calcarea floor because they could make out that the patient belonged to calcarea family because of dreams of unsuccessful efforts, and floor was, and then once it was the calcarea family because of several other symptoms as well. There was craving of eggs also. There were other symptoms as well. But when the calcarea family was decided, then came the distinction of which salt of calcarea should we give. So the patient was hot, so automatically iode, calcarea sulf, and calcarea fluor was zeroed on. And then it was very easy to pinpoint on calcarea floor because of the heat, the kind of spices the patient want, the kind of syphilitic miasm that was in the background. So the case, you won't believe, but the case was taken up on a very short while, on a very short time, and calcarea floor was absolutely the correct medicine. It was given, and the child is absolutely healthy till today. Though the doctors over there, the gynecologists and the obstetricians who were there at that time, they had said that we will be able to either save the child or the mother. And even if the child is born, then there may be several birth defects. So we do not take any kind of responsibility for that. The patient was admitted in ICU for 15-20 days, and we started to give our medicines. We told the patient was in Faridabad, I was in Lucknow, so I had communicated it on phone. And the moment the patient started taking the medicine, there was improvement, and the child was born normally. And I would like to add over here that calcarea floor actually softens the os and the ligaments, and also it facilitates the normal birth. At times, if it is given in the last trimester or even in the 8th or 9th month, then it definitely facilitates the childbirth. So this medicine was very useful, and the patient is very healthy. I am very sorry that I'm not able to put up the reports just now. Next, please. Another very important case that we tackled, fortunately, I have the details of the patient and the reports as well. So this was a patient from Aligarh, and again, my students only took up this case because at that time, when the COVID, during the second wave of COVID, there were so many patients, and most of my patients were taken up by the students, and they were taking care of them. So in this particular case, we had a student had suggested Ignatia. Why? Because of the death of the sister few days back. The patient's sister had died because of COVID, and we could not we were not able to find very important or very pointed symptoms. The patient was in a very, very bad state, and she was not hospitalized. She was not given oxygen. Next, please. So this is the CT score of the patient. The initial one was 22/25, which was very severe. And just I think after 15 days, it came down to 13, and the patient is hale and hearty till today on the simple prescription of Ignatia. I prescribed Aspidosperma as well, but it was there was such a shortage of Aspidosperma and all the medicines related to lungs in homeopathy. I mean, all the homeopathic medicines, there was so much of scarcity, so much of shortage that I just told the patient to take Ignatia and they were improved. Next, please. So I had asked them to take 1 dose of Ignatia, and I had this prescribed Aspidosperma as well. But since it was not available, the patient and Ignatia was readily available. No one thought that Ignatia will be ever useful for COVID patients. So Ignatia, the moment the patient took Ignatia, after 1 or maybe 24 hours or 36 hours, the patient reported improvement. So this is how the prescribing has to be done at times. Next, please. And for helping the patients during COVID, with my students, I got this certificate of commitment from World Book of Records, London, and any one of you can get it with a little bit of obviously hard work. Next, please. Thank you so much. If there are any questions, I would like to have them.
Participants, please raise your hands and ask question to Dr. Lubna. Please. Excuse me, doctor, can I stop sharing?
Yeah, definitely.
Dr. Ahmad Hassan.
Any questions?
Good evening, madam. No, thank you very much for your restructuring about the syllabus. Definitely, it is the need of hour. And you mentioned all paraclinical or clinical, all subjects. But really, pathophysiology, immunology is the most demanded field nowadays for publication of research work. Jazakallah khair. Thank you very much.
Thank you, Dr. Ahmad Hassan. And anyone from the participants, if you have questions, please raise your hands and ask questions. When we are about to end the session, everyone will come and ask questions. So please start from now.
Yes, and they can share this disagreements as well. I mean, most welcome. Suggestions, disagreements, whatever.
Yeah, Helen, please.
Doctor, your presentation is nice, very good. But I like to ask, see, during the homeopathic medicine, during the course of dialysis, how will be the effect? Comment it.
Madam, please unmute and talk.
All right. So during the dialysis, for 3 hours, we do not give our medicines. For the rest of the time, we continue the doses as such. There's hardly any problem with that.
But I'm not, pardon, madam. I'm not, no, it is not clear what you are telling.
Only for 3 hours when the patient is being dialyzed, we do not give our medicines. Otherwise, we continue the medicines when the patient is off dialysis, like when they return from the hospital, they continue to take the medicines. There's no problem with that.
Usually after the dialysis, the homeopathic medicine is not working properly. That is what I'm asking. That I was-
no. This is a misconception, absolute misconception. I've not found a single case where after dialysis, the homeopathic medicine has stopped working. Not even a single case in 20,000, more than 20,000 cases. Rather, there are patients who have undergone dialysis twice or thrice. They continue to take our medicines. Why? Because it improves their quality of life, it improves their energy level, it improves their appetite, it improves their urine output. So there are a lot of patients who actually have to bear both the cost of the dialysis and the cost of homeopathic medicine, but they do. Why? Because they say that they are a lot better while taking the homeopathic medicines. Otherwise, there are patients who have reported that once they stopped the homeopathic medicine, their urination abruptly stopped completely. And when they restarted the medicines, then the urination was improving and they continued to urinate. So there are a lot of patients you'll find where the homeopathic, if the homeopathic medicines are being given along with dialysis, the urination never stops. They continue to urinate, which is very important because the more the cycles of dialysis, the lesser is the urine output. And after maybe 6 months or maybe 8 months or maybe a year, the urination stops completely.
Okay.
Yeah.
Okay. Thank you.
So-
Thank you.
Thank you, Dr.
Yeah.
Hariharan. Now, Dr. Sucharitra. Dr. Sucharitra, please.
Yeah, good evening, ma'am. Thank you so much for today's Zoom meeting. It was very much informative. I would like to ask you, like in case of CKD, dialysis would be happening in end stage for almost whole life. So, what is the role of homeopathy in that case? Do patient has to take the homeopathic treatment along with dialysis for the whole life? And what are the stages where homeopathy can, give improvement or reverse the pathology?
See, the most important thing is that homeopathy helps right from the first stage, the CKD, stage 1, till end stage renal disease, and even after transplant. I have patients who are taking homeopathy even after transplant because it got rejected. So homeopathy helps in all the stages. It definitely arrests the progression. At stage 3, you can bring down the patient to stage 2 and even to stage 1, and even the creatinine might become normal. But the most important, even if you keep the reports apart, the most important thing is that homeopathy helps in all chronic diseases for improvement in quality of life. With homeopathy, the patient will always say that they feel better, that their energy level is better, they are able to move about, they are able to enjoy, the things around them, which otherwise, especially very useful in cancers, especially the patients who are undergoing radiotherapy and chemotherapy. They lose interest in everything. They cannot eat, they cannot enjoy the food even if they eat. They lose interest in almost everything. They are depressed. But by taking homeopathy, there is definitely a feeling of being well, being okay.
Okay.
So I would
Thank you
suggest
so much, ma'am.
is all the stages.
Thank you. And we have question in the chat box where from where we will get your books.
It is still under publication. Actually, it is not yet published. So the moment it is there, on the stalls, I'll let you know.
Madam, your approach is constitutional prescription along with organ remedies. That is,
Yeah.
it is the method of your prescription. Is it so?
Sometimes actually, if I'm very sure of the similimum, I go with it. If it is an autoimmune case, then also I just go with the similimum. But if there are other things involved and if I'm not very sure of my prescription, I definitely give organ medicines or whatever is indicated. Like if there's a case where there is massive swelling, be it a liver case, be it a kidney case, if there's massive swelling, I have to add something to work, which would work as Ditor or Lasix, which would bring out the fluid which has accumulated. So at times, if the constitutional medicine is not working very well in elevating the swelling, I have to give something other than the constitutional medicine like Eposinum or Apis or Barovia or something like
Doctor, which your potency selection, how is that?
for constitutional medicines, I usually give in 50 millisiemens scale, and rest of the medicines, the palliatives or the ones which are given for the trivial complaints, I usually give in 30. Then there are other medicines which I give in mother tinctures as well.
Okay. Good.
Constitutional medicine is almost always in 50 millisiemens.
50 millisiemens. Which potency you will start? LM1 or 2 or 3?
Yes, LM1, usually the LM1, but if the case is like very severe and if I'm sure of the medicine, then I can start with, at times I've started with like 3 or 5, even like in 80 PKD cases, autosomal dominant polycystic kidney diseases, I usually start with 0/3 or 0/4.
Okay.
Puja especially, if I'm giving.
How is the frequency?
4 times a day or 6 times a day or 8 times a day, the constitutional medicine. Again, that depends on the severity of symptoms.
Okay, thank you, thank you. Follow. Good, good.
Thank you, Dr. Hariharan. And there is no Dr. Danish.
Good evening, all, and good evening, Dr. Lubna Kamal. It's really an exciting session from you, because you, being an academician, you are really concerned about the future of students and why the students are failing in all these aspects. But we know that we have a solution in homeopathy to everything. As you rightly pointed out, when you entered into a homeopathic clinical college, there was nothing like in any other allopathy hospital, but things are entirely different nowadays in our area. In almost all homeopathic medical college, we have every department with full-fledged facilities. And even in our government department, even in our hospitals, we have the examination technicians are there, and there are facilities for ECG and this not only ECG, even a USG. The scanning machine is there in our homeopathic hospitals, and everything is being placed in our hospitals. And as you know, Kerala is a well-fledged, has a well-fledged system in government department, where more than 600 doctors in government sector and more than nearly 500 doctors in national homeopathic mission session. So already there are 1,000 doctors working in that way. That itself is a boost, because a lot of patients are there. You can see heavy rush of patients in almost all homeopathic government clinics and hospitals. So also in private practice, most of the doctors have having practice of at least 20 to 50 patients a day. And there are doctors who are having 100 to 300 patients a day. This is a reality in Kerala, and that's the reason why the so-called people from allopathy side is giving case against homeopathy. It is unscientific, and this is to be eliminated from this world like that. And that's, as you know, there is a case filed by Dr. Abhi Philip against distribution of this arsenic album. But as far as we are concerned, we have a very good department in our ICE system. where our National Homeopathy Research Commission can also submit all the documents so that people all over the world will know that there is a research going in homeopathic system. And that will definitely give an opportunity for us to show the world that homeopathy has this kind of things in. And the Department of Kerala is also able to give all documents, because there was a study on arsenic album by the government department in Kerala. So we are well equipped with the challenging the case against the Philip case at the Supreme Court, and definitely that will give a wider opportunity for homeopathy to show how it works. And if anybody have a doubt, you can go and visit. Even the Supreme Court may visit our site to see how the research is going on. But as far as allopathy is concerned, only though ICMR is there, most of the research work are done by private doctors, private medical fraternity or medical pharmacies. But here entirely different work is going on. And we can also show our homeopathic pharmacies also, how well equipped are these things. In Kerala also, we have a wonderful.
Dr. Danish, now it is time for the Malayalam session. Now it's 9 o'clock. I think you can say a vote of thanks to Dr. Lubna Kamal also. And Dr. Lubna Kamal was about to say something. I think so.
Yes. Yes.
Oh, please, madam, please.
Yeah, actually, I was about to say that the college from where I started studying, the first day I went there, it was a cow shed actually. And there were just cows and buffaloes outside, you know. So it was very disappointing to enter a homeopathy college after CPMT exam, after clearing the CPMT exam and going to study in a cow shed. So actually, a lot.
Yes, it's really a wonderful session from Dr. Lubna Kamal, and we are proud to have such a wonderful presentation at this forum. You are making it so many times, and hope you can also make some more presentation in the future. And on behalf of IFBH and myself, I am thanking you. Good night, madam. Thank you.
Thank you, Dr. Danish. Now it is the time for the Malayalam session, and I'm welcoming Dr. Shaila. Dr. Shaila, please.